I am Dr. Atul Shrivastava, Consultant Orthopedic Surgeon at Narayana Hospital, Howrah. The most recent advancement in knee replacement surgery is the use of robotics. So, robotic knee replacement surgery has got many distinct advantages over conventional knee replacement surgery. What is robotic knee replacement surgery? So, there are distinct steps which are done in a robotic surgery. First is planning, then is registration, then bone cuts, and final implantation. So, before starting the surgery, we get a CT scan done of the patient's leg. This CT scan is fed into the robot. Next comes the planning. So before the surgery only, we plan the surgery completely on the robot. What size of implant will be used, how much bone cuts will be taken, everything is planned before the surgery. Then comes the surgery part. So during the surgery, we do registration. We let the robot know what are the distinct steps and distinct parts of the knee joint by using a pointer. So once the registration of the knee is done, then comes the bone cut. So we use the robotic arm to carry out the exact bone cuts that were planned before the surgery. And the last step comes the implantation. So once the bone cuts are done, then we implant the knee, the femur, the tibia and the poly. So what are the advantages of robotic knee replacement surgery? When compared to the conventional knee replacement surgery, robotic knee replacement surgery is very accurate. Less than 1 mm accuracy and less than 1 degree accuracy is achieved. So that gives a distinct advantage. If you do a very accurate knee replacement surgery, then the life of the knee or the longevity of the knee is increased. Next, in robotic knee replacement surgery, the soft tissue handling is very minimal. Since the soft tissue handling is very minimal, post-operative pain is reduced and the recovery is faster. Third advantage, distinct advantage, is that in the knee replacement surgery, normal conventional knee replacement surgery, the blood loss is more because we have to open the medullary canal. In robotic knee replacement surgery, we do not have to open the medullary canal, so the blood loss is less. Since the blood loss is less, the soft tissue handling is less, so the surgery becomes much more safer. So in patients who already have cardiac or renal issues, doing a robotic knee replacement surgery is safer than a conventional knee replacement surgery. But some myths are also there attached to robotic knee replacement surgery. There are some people who say that in robotic knee replacement surgery you don't need to do post-operative rehab. That is completely wrong. The rehab protocol for a conventional knee replacement and robotic knee replacement surgery is the same. Robotic knee replacement does not mean that you don't have to do exercises post-op, but the recovery is generally faster. Next, some people say that is very minimal invasive. Although we don't handle the soft tissue a lot in robotic knee replacement surgery, but the incision which we make over the knee is almost the same as the conventional knee replacement surgery. Third myth which they tell that the surgical time is less, or when we do a robotic knee replacement surgery, the surgery takes less time. Again, that is a myth. The time taken for a robotic knee replacement surgery and the conventional knee replacement surgery is almost the same. So barring all the myths, there are distinct advantages of robotic knee replacement surgery. As we'll again go on that, number one is the accuracy. It's very precise, and that's why it helps in the making the life of the implant or the longevity of the implant more. Number two is less soft tissue handling. That means less post-operative pain and faster recovery. And number three, less blood loss because we are not operating the medullary canal. Less blood loss means a safer surgery. These three are the distinct advantages of a robotic knee replacement surgery. Thank you.